100% the consumers are the most rewarding part of the job. We serve a population that is oftentimes forgotten. So when we come there, they become our family. I love to engage with all of the clients, have them tell me about their day, how they're feeling, and just to see their personalities. They're so individualized. It just makes coming to work not feel like work.
My favorite part about working for DDSN are the consumers. I enjoy their personalities, I enjoy interacting with them, and I enjoy being able to make a difference in an overlooked population.
We have some consumers that are bedridden, that they can't talk, that can't hear, but you can just see when you're standing there talking or touching them, the little sparkle in their eyes, and it's everything. It really is.
The consumers are the best part of my day. The consumers are everything about Sleepy. They make all the days better. They've taught me a lot of lessons and taught me a lot about love. That's why I'm there. I met my calling when I came to Sleepy.
We're more interested in that family dynamic. I mean, I've worked at large hospitals. I worked in the ER. I've worked in med surge and different types of nursing. And the one thing I think is different is that everybody focuses so much on family. We are a family.
Working with other facilities, nursing homes, it's such a hustle and bustle because you have so many clients and they have, different needs than what our people do. Hospitals, it's always admissions and discharges. So here we really get to know the clients and the families and are able to be a part of their daily life.
I think being a nurse at DDSN is different because you have reward in helping your patients become independent, helping them learn to take medications on their own, helping with medication programs, helping them go out and do things in the community and getting pleasure rewarded whenever you get to see them do well at work.
You get to build a relationship with them and they're there. I mean, we have people that have been there for 30, 40 years. You get to know them.
You're with them on a daily basis. They become more like your family. It's not like you're in a short-term facility where they're sick, they're there for 3-4 days, and then they go home. They're your family. I mean, they become a part of your everyday life.
Considering DDSN PD Center is their home, it's more of a true continuity of care. We're able to come in and establish great relationships with all of the individuals. We get to cater to their individual needs, treatments. It's more of a family-oriented atmosphere. It's just different than any other job. It's just so rewarding. I love it.
They really need to be empathetic along with compassionate. You need to know that they are people just like we are. They don't communicate like we do. You have to learn their communication. Or some of them don't really communicate very well, but that's still their form of communication.
They have to be compassionate, they have to be patient, and they have to have an empathy because the population that we serve, they're just like you and I. They want to be treated with dignity and respect, and they have to always realize that when going to any engagement with any of our consumers, they're just like you. Treat them as such.
I feel that you have to be compassionate and have patience. The regional centers are considered home for a lot of our clients, so we must be able to adapt to their environment since it's their home.
Patience is the number one virtue. I work a critical care unit, and most of my patients, they don't speak. A lot of them are bedridden, they don't really move, so you have to learn their gestures, their eye movements, when they're angry, when they're sad, but patience, because you're not going to get all the answers you want just walking in and taking a look, because there's an open book. You just have to be patient enough to read the pages.
Any nursing role, you're going to know your medications. You're going to know how to handle emergency medical situations. You're going to be able to handle the basic nursing stuff. That's the one thing. But the difference being is that your patient is different. Sometimes they can communicate, sometimes they can't. And sometimes you have to take the time to learn how to communicate with them because they're trying to communicate with you and you have to figure it out.
They got to be able to not only have the nursing skills, but they got to be able to have that love, that caring. You got, so you because you're in someone else's home, you're in your individual's home, and you got to be able to sympathize with them and find their needs.
I feel like at the PD Regional Center, our work culture is team oriented. Regardless of your position or title, we promote inclusiveness. Over the past 8 years at PD Center, I've developed lifelong relationships with the nurses.
We are truly a team. Everything is attacked at the team aspect. We lean on each other for support, for guidance. If we're having a bad day, I can call my other nurse supervisor or any other unit nurses to get me through any of a rough day, or just to share stories. We do gatherings inside of work and outside of work. It's not a job, it's a work environment that's like family.
Not only are we a family as far as the consumers, but we're also a family as far as our peers, our fellow nurses, our doctors, our nurse practitioners. Like we learn from each other, we lean on each other, we teach each other. It's like another family, a home away from home type of situation here.
We just had somebody pass away, but just getting him to the hospice house and getting to say the goodbyes. I mean, it's somebody that's lived with us for 30 years, and helping him transition that way, Because like when they go other places, people don't see them for who they are. A lot of times they just see them for their disability and they don't see that they have a worth in life, But we get to know them and we love them and we care about them and we get to see their personalities that other people on the outside don't get to see.
I do the South Carolina Special Olympics with our consumers and go to the Special Olympics with them as their nurse, and it is very rewarding watching them practice for months, get ready and go play bocce ball or disc golf, and seeing them stand up there and get their medals is very heartwarming.
I don't know. I mean, somebody made a new noise while I was talking to them, and I'm like, I understand. So, yeah, I mean, it's an everyday thing. It's not just every now and then that I get amazing things to happen. It's really every day.